New research and technology. New research on the timing of the first heartbeat in a fetus has been changed to 16 days after conception. This was done by studying mice, and researchers found that their first heartbeat was at 7.5 days, and the human equivalent would be 16 days. They found that the heart can beat as soon as it forms the cardiac crescent, which is a stage of development in a fetus's heart. This stage right here. Previously, they thought it was during the formation of the linear tube, which is a little bit after. They found that fluorescent markers on calcium molecules in the mouse embryo signals the action potential of contracting heart muscle, which creates heartbeat. And the NCX1 protein helps generate these calcium signals. This new research has let us better understand how the heart develops. And you can see here, there is an article on it. And it says that before they thought it was 21 days after conception, but now researchers think that is 16 days after conception. Another new research is the effects of maternal chronic disease. This study was done in Taiwan, and it has found that there's a higher risk of having a baby with a severe congenital heart defect if the mother also has congenital heart defects, or if she has type 2 diabetes. And also there's a higher risk of a baby with a mild congenital heart defect if the mother has type 1 diabetes, high blood pressure, anemia, or epilepsy. This means that high-risk women should go for screening more often and get a fetal echocardiography, which can show the development of the fetus's heart. But researchers caution that although if you have one of these chronic diseases as a mother, that does not necessarily mean that your baby will have a congenital heart defect. A new technology recently was the Amplatzer Dect Occluder 2 additional sizes device. This research was done in the US, and they're currently on a clinical pediatric trial for new treatment of the patent ductus arteriosus. Before this device, the children would receive treatment with adult-sized devices. So this is an experimental option that could help these children with surgery. It's designed to fit the smallest ducts while achieving complete closure. So this device here will go through a catheter into the ductus arteriosus and try to plug it up. They're currently accepting up to 50 patients at 10 different sites in the US. So 15 or more patients who weigh 2 kilograms and 25 or more patients that weigh less than 2 kilograms. And this is what the device looks like. Another study done in the US was the risk of neurodevelopmental issues for children with congenital heart defects. And it has shown that congenital heart defect patients are at risk for neurodevelopmental and psychosocial impairments. This prevents them from thriving even more than the cardiovascular residual issues. Some reasons for these issues could be structural abnormalities of the brain, so an immature brain, damage during surgery due to low blood pressure, low oxygen, or bleeding, and a higher incidence of white matter injury, which is injury to the myelinated axons of the neurons in the brain, and also because congenital heart defects are associated with different genetic syndromes like Down syndromes and other chromosome and genetic abnormalities. This could also affect the child's brain development. About 75% of children with a complex congenital heart defect are at risk for language impairment, ADHD, like this boy here in the picture, executive dysfunction, which affects the brain's capacity for memory, self-control, reasoning, problem-solving, and flexibility, visual processing issues, which affects how the child learns at school, how they read and see words and pictures, fine and gross motor problems, which affects how they can use their body to do things like write with a pencil or kick a ball and other fine and gross motor problems, and also behavioral and emotional difficulties like this child here. They're prone to being very emotional and having behavioral problems in school, at home, and in public. More than 30% of them need services like tutoring, special education, and physical, occupational, or speech therapy. And there's research now being done on de novo gene mutations expressed in both the developing heart and the brain. De novo mutations are mutations that occur within the egg, the sperm, or the fertilized egg, and they're not part of the genetic makeup of the mom and the dad. So this is a problem during fertilization, not with the genes that are being passed on from the parents. And some researchers have found that some genes are expressed in both the developing heart and the brain. So this could mean that a single mutation for both that could cause a child to have a congenital heart defect could also cause the child to have neurodevelopmental abnormalities. As always, there's always new research and technologies that are being developed.